So thank you guys for coming. I am Morgan Barnes. I am the coordinator for the North and South Dakota Perinatal Quality Collaborative, and I'm really excited to see so many people on this call to learn more about our upcoming initiative, Improving Care for the Maternal Infant Dyad Affected by Substance Use Disorder. We are going to have a maternal focus and an infant focus over the next 2 years, but this first year is going to be all really focused on the maternal side. Let me get my slides up here. Okay, so if you guys can all see that, then we will be good. So as I said, I am the coordinator for the PQC, and I will be kind of your main contact throughout this whole onboarding process, enrollment, and basically for any PQC related stuff. You'll be hearing from me. So before we jump into this, into our, sorry, more people are coming in. Before we jump in, I want to give you guys all a little history about the PQC. I know I see some familiar names, but I also see some that we haven't worked with before. So just so you guys have a little background on our organization, we were founded in 2018 by a very dedicated group of healthcare professionals that saw that our states didn't have a PQC and all the other states did, and they created our PQC for us. Many of those initial leaders are still playing an active role in our leadership team today. Our work at the PQC is all guided through our leadership team. And this team is comprised of a wide range of professionals. We have OBGYNs, we have neonatologists, midwives, professors, representatives from hospital associations, health departments, other public health stakeholders. And so we have a really good range of views to help guide this work. In 2021, we kicked off our very first initiative on identification and treatment of severe hypertension. We had 9 hospitals participate with us. We had a small pilot project with 5 hospitals, and then we opened it up to a full-scale 1-year initiative where we worked with 9 hospitals. And throughout that 1.5 years, we were able to have a 78% reporting rate from our hospitals. And all of those that were reporting that they were seeing improvement in all of, and they were all seeing improvements done through the quality improvement work that our PQC was leading. We were also able to, sorry, I have a couple people coming in on the group. So, okay, sorry, back to, we partnered with the North Dakota Department of Health and Blue Cross Blue Shield of North Dakota, and we were able to offer a professional blood pressure training through this training that they had created, and we were able to get 413 professionals throughout our region over that 1.5 years trained, and everybody got a really good refresher on blood pressure measurements. In fall 2022, and really starting in the summer, we were working on applying for grants, and we were awarded a 5-year CDC grant that is really going to help build our capacity at the PQC. We'll be able to hire some more staff so we can better support all of our hospitals that are participating with us. We have a new executive director, Dr. Andrew Williams. He's an associate professor at UND. And with his leadership, our PQC is now being housed within UND. So that was some really exciting changes that happened over this last year. Now, as we look forward, this is kind of what our timeline for the next year of our initiative is going to look like. I'll be going into more detail with some of these points, but January to March, our enrollment period is open. We want we want all the hospitals to join this. And so please look into coming aboard and partnering with us. We will have some baseline data collection that we're going to ask to have happen, just so as we get into April and we kick off with our first learning session, that we'll have some good baseline data to go off of as we move forward in our quality improvement work. We'll have 3 learning sessions over the next year, and it'll be in April, August, and then next January. In between these learning sessions will be our action period, and I'll go into a little bit more detail in a couple of slides. So open enrollment and onboarding. To enroll, you will need to complete a statement of intent. Now, this is a fillable PDF that you can download off of our website. Please fill it out in the PDF and then save it as a PDF. And that way, copying email addresses, there won't be any chance for mistyping or getting people's emails wrong. So we have their correct contact information for you. With your statement of intent, you will be putting together your team that's going to be working on this quality improvement project. So depending on your staff capacity and staff size, you can have 2 members, you can have 5 members. In our last year, we had some of our smaller hospitals had 2 people working on it, and other hospitals had 7. And that's just fine. Whatever fits your hospital, let this fit you. And so you'll assemble your team, you'll commit to making changes and attending learning sessions, and select where your first initial unit and where you're going to be testing your changes and where that's going to be at. Once I have a completed statement of intent, we will have an onboarding call, and that will be the day-to-day leader who you select in the statement of intent. That's going to be your main contact for your team. I will meet with them. We will talk about some gaps in the care and what you need from the PQC to really succeed. We'll schedule some monthly check-ins that will have just kind of a standing call. Doesn't have to be a long call. It can be, 15, 20 minutes. And we'll schedule it around your schedule and your availability. We'll review the data collection plan and your team's capacity, and have an opportunity to answer any individualized questions at that time as well. So learning sessions, what to expect. And now some of you have been part of our learning sessions, but for those who haven't, these are going to be 3-hour meetings. We will have a variety of presentations for you from professionals on topics related to substance use disorder, quality improvement science, trainings, giving you information on other resources available throughout our region, and any other relevant information that we can give you to help you succeed. That's where we're going to share that. We'll be sharing the data that you submit. We're going to aggregate it all together. We're going to look at, this is North Dakota's stats. These are South Dakota's. These are our PQC as a whole. And so it's really important that when data submissions happen, that they happen on time. So we have enough time to aggregate that all for everybody. We really want to foster an all teach, all learn environment where we openly share and help one another. We will have a storyboard section in each session that we will assign or ask hospitals to present on kind of the work that they are doing. And so maybe you'll share some of the successes that your team has seen, some of your barriers. You can solicit for advice and say, hey, we're running into this problem. Has anybody experienced this? What advice do you have? What's worked? What hasn't? And really let it kind of open the floor for our hospital teams to discuss and help support each other as well. Because if one hospital's facing a barrier, there's a really good chance someone else on that same call has faced it or is facing it as well. And we want this to very much be a collaborative where we all work together. Again, here are our learning session dates. Now, in between our learning sessions, we will have our action periods. We'll have one-on-one monthly check-ins with a day-to-day leader and me or someone from the PQC staff once we get some more people hired. We'll help you set 30, 60, 90-day goals to help keep you on track and then support in carrying out the PDSA cycles and small tests of change. We will be holding topic calls each month that there isn't a learning session. And these, everybody's invited to come. You don't have to necessarily be participating in the PQC to join these topic calls, but we will have a variety of topics, not necessarily substance use disorder, that we're going to be sharing, but it's just another way for our PQC to help disseminate information to all of those in our region. And our first one is going to be in March. So please, if you haven't registered for it, go register. It's going to be with Dr. Muhammad and Dr. Lee at Sanford's NICU in Fargo on their micro-preemie program. And that is a program that really services a lot of the region. And so it'd be great to have as many people come join that call. Now we kind of get into the data part of it. We have our measures that we're going to be following. These measures all came from the Alliance of Innovation in Maternal Health, the AIM patient safety bundles. This, we took their SUD bundle and we worked with our leadership team on identifying a few to narrow it down a little bit on what we feel like would be most important for our region. And this is what we came up with. As you can see, we'll be looking at opioid use disorder and substance use disorder, looking at referrals and screening and counseling on like medication for opioid use disorder, treatment services, and provider and staff training. We are putting together some trainings. We're looking at a couple different options, but just know that there will be some trainings that will be coming from the PQC to your teams that maybe if your hospital or your clinic doesn't have specific substance use disorder training, we can help supplement with training from us. And then we'll be also giving out a resource map that's going to be very maternal focused, and that's also in the works. And but yeah, so these are our structures that we're going to be looking at. Our data collection plan, we for outcome and process measures, we're going to be asking for numerators and denominators. We want monthly numbers. You'll submit them quarterly, but we want it broken down by month. And then each measure, we are asking for an overall numerator and denominator, and then also seeing those numbers disaggregated by payer type and by race and ethnicity. Structure measures are all reporting a date of implementation. So if you already have something, if you're already using validated screening tool, if you're already have pain management guidelines set up for your hospital or clinic, then you've already implemented it and it's done, and you won't need to do any further work on those. The data sets that we are wanting to collect will be collected through a REDCap survey. We are doing a survey instead of having everybody create a REDCap account and have to log in and then input the data. These surveys will be links that will be sent to your day-to-day leader, and they will be due prior to each learning session, about a week and a half before each learning session. The nice thing is you don't need a REDCap account, you just need the link. And we have created a data collection tool. It's an Excel file that, and we have different files for hospitals and for clinics, and I'll kind of give you a snapshot of what those are going to look like in just a minute. But these will be to help us get consistent tracking, and these Excel sheets will be used in-house only. You won't have to share those with us. But if you keep track of it all in one place, it makes everything so much easier. And it corresponds directly with the REDCap survey. So as you're working through the Excel file, you'll see exactly how it follows with our REDCap survey. So this is kind of a snapshot of what our hospital data collection is going to look like. We have it going out through April of next year, but really we're going to be looking to track through December, and then looking at sustainability after that point. But we want overall numerator, denominator. The rates are there for your use only. All you're going to have to give us are the numerator and denominators. As you can see on the bottom, there is a measure on each sheet. And so that way, hopefully it keeps it nice and organized for you. And we have our definitions for what constitutes the denominator and what you need to look for to get your numerator number. And again, these were all pulled from the AIMS patient safety bundle for SUD. So if you want a little bit more information, you can go look through their data collection tools as well. But we have pulled a lot of our stuff from them and tailored it to what our needs are and what we're going to be looking at. For our clinics, a lot of the structures are to look at like prenatal up through birth discharge. And so we don't want our clinics capturing data that the hospitals are going to capture and risk double counting patients. So we're going to be looking at what EMR capabilities and what's being tracked in clinics. We'll keep the staff training for clinics. Pain management guidelines. Clinics will also be given the resource map, so they will have support in knowing where to refer patients when they are screened and identified to have a substance use disorder or opioid use disorder, and can help support your team, support your patients. So we have our data due dates. These are our submission due dates, and then each of the months that we will be collecting. And so that's just kind of a little snapshot. They're all about, a week and a half before each learning session. So participant benefits, I mean, you're all probably sitting here thinking, what's in it for us? That's a lot of work on your part, but we will be benefiting you as well. We are going to be compiling a resource map with that maternal focus, and that will be shared to all of our participants. We are going to be providing some provider and staff training, and we'll have monthly coaching calls, individualized support, and accountability, and we can help you troubleshoot with whatever comes up. We will foster this all teach, all learn environment. PQCs all across the nation kind of go by this steal shamelessly and share seamlessly kind of saying, that everybody is very open and willing to share and talk about what work they have done and what works. And so we not only have our information and the support from AIM and from the CDC with our grants, but also from the national network of PQCs, and a lot of other states are currently doing work on SUD or have finished. And so we have a really great network that we can reach out to if to help support our hospitals and clinics that are participating with us. Another really cool thing, the CMS requirements are changing a little bit, and to get a birth-friendly designation, you have to be working with a state quality collaborative, and that is what we are offering. So come work with us. There's a couple links. I'll share these slides afterwards as well, but that go into a little bit more detail. I know some of our smaller, like critical access hospitals or rural hospitals, might not fit into what they need for this designation, but participating with us will help you fulfill that requirement. So are there any questions? I know I went over that fast, but I wanted to leave time for questions. So if there's anybody that wants to come off of mute, if you have questions, please do so. No questions?
Morgan, this is Paige in
Yes.
Pierre at Avera. Hey, do you think we could get your slide deck that you just went over to review?
Yes, for sure. I will email these slides because I've got everybody's email. And the recording will be available on our website probably tomorrow. I'll have it being downloaded. And then I'll also put the slides on our website. So I'll email it out to everybody that's on this call or that has registered. So if you have maybe a colleague that registered and weren't able to jump on, it will all be available as quickly as I can get it.
Okay, thank you so much.
You're welcome.
This is Danny Thurtle. I'm a pediatric hospitalist and a nursery director in Bismarck. You said like the first year is going to be a maternal focus and the second year is an infant focus.
Yes.
Or did the measures change, or can you just describe how that works?
Yeah, so these measures right now are really looking at the maternal care from prenatal to discharge. And now next year, we're going to be kind of putting together what measures make sense for improving care for that infant that is affected by substance use disorder. Some measures that other PQCs have done is like breastfeeding rate, time in the NICU, who the baby is being discharged to, if it's going to a biological parent, or who is taking that baby home, I guess. And so we are going to be looking at meeting with our pediatricians and neonatologists that are interested in helping us create what that initiative is going to exactly look like. But right now, like, the measurements will be different, but because it'll be that focus on the infant.
Thank you.
Okay, any other questions? Okay, well, if there's no more questions, I just want to thank you all again for being here and taking up some of your lunch hour to join this call. The slides and recording will be available, and I'll email it out, and it will also be available on our website. And I will also send a copy of our statement of intent, so your teams can get started if you're interested in joining. We really want to include as many hospitals and clinics as we can, so we can make a bigger impact on our population as a whole. And if there is nothing else, I think we're okay to close. Last call for questions, if there's any. I don't want anybody to leave not feeling like they're able to ask a question. Okay, and again, you all have my email address, and so if any other questions come up, please feel free to reach out to me, and I will be happy to get you whatever you need. Thank you all for being here. Oh, okay, yep, slides and recording will be available. I just saw the chats, so. All right, well, thank you and have a great afternoon.